Hello guys, this is Efren for discussion number 4. Hope that everyone is doing great. So what I have learned most about my experience, as you already know, I was doing a lot of hours and doing my interventions in a chiropractic clinic. And there's not only one thing that I could point about what was the most important thing. So first of all, I was trying to do some evidence-based practice interventions with the cervical spine and the lumbar spine. I really believe that I was trying to do, I had the opportunity to work more with the lumbar spine. But yeah, there's a lot of patients that have cervical problems. So I would say that the incidence is kind of close. And for me, it was very important to learn a little bit more things about the cervical spine because, as you know, we don't do a lot of interventions on the athletic scenarios when compared to other anatomical areas, shoulders and hips. And for me, it was a great experience to get involved in that, to learn more rehabilitation programs, exercises, different instruments that we can use to provide those services, and to review a little bit of the evidence about that. So and it was very important for me. So I now feel more confident when I have a patient with a cervical spine problem, how to handle that, how to work with that. One of the things is trying to select the patient-rated outcomes that are more associated to the injury of the patient or the condition of the patient. Well, at the beginning of the semester, one of the assignments that I created was to try to identify different patient-rated outcomes or clinical decision, clinical prediction rules of the lumbar spine and the cervical spine. And there's a lot, but when you go there and have the patient and trying to do something related to this is very difficult because there's different circumstances. Not all patients have the same problems or their life circumstances. So I think when you got the experience, then you start to analyze. Okay, in this case, it's better to use this PRO or clinical prediction rule, or I prefer to use more than one because I'm trying to find something related to this thing, and the other one is going to help me to measure better pain or how the rehabilitation program is doing if we are providing some effective services. So I believe that when you go to college, and start to learn a little bit more things about the evidence-based practice model regarding to clinical prediction rules and patient-rated outcomes, you learn a lot, and you know the existence of a variation of those things. But then when you are in the clinic, the situation is different. So I believe experience is very important for that, trying to get more deep on readings and find some evidence about that. But I think the experience is very important. And the other really important thing is how you can communicate with the doctor and have the opportunity to integrate your services related to evaluations, and how you can demonstrate that the idea that you have is going to be good for the doctor or for the clinic, And I really believe that we need more education of what we already have related to patient-rated outcomes and clinical prediction rules. So I can assume now that one of the changes that I really believe could happen in the academy, the bachelor's degree, master's degree, is to integrate this kind of evidence-based practice things, but having more impact on that, learning more about that, getting more confident of using it, and selecting the appropriate one in a case, maybe as part of the clinical internships. Trying to get more focus on that. And the other thing is clinical prediction rules important for the scenario. We know that they are good to make decisions, but then when you are in real life, the doctor have less time than the time that you want. So at least if you get experience on that and you feel more confident, maybe you can do it quicker and selecting the appropriate one. But then trying to convince the doctor, hey, these clinical prediction rules can be used to have to take a better decision, and how that can impact the services provided is kind of difficult. For now, in this clinic, the programs, different services were programmed. The Oriental Medicine program, the rehabilitation exercises program, the only massage, and once the doctor have the evaluation and they have the clinical findings, he just stick with that program, but the clinical prediction rules are not used as I believe were used before. So it's very difficult, in just only one semester. It's very difficult to try to convince doctor and sit down and discuss about it. That's what was one of the challenges that I saw in my scenario, in my experience, and it's very interesting to see further, right, in the future, how we can use these clinical prediction rules, and how real are when you are facing the patients or trying to integrate it in your daily interventions. This project have changed my vision of how we can provide better services. Of course, it has. First, I didn't know about the electroacupuncture therapy. With this therapeutic intervention, the doctor used the acupuncture needle, but then he stick with an electrical stimulation machine, and now he used the needle to go inside very deep on the tissue, probably going directly to the muscle, and then the electrical intensity goes down there. So we know that we can use different electrotherapy interventions, and once we have find the motor unit, then we're gonna have a contraction, activation of the muscle. But I believe that this electroacupuncture intervention is better. My experience was that maybe I found in my evaluation that there was an athlete. We have a case of an athlete that was having problems at the hip and the low back, but we found that the main problem was the gluteus medius, and we believe that it was dormant. There were no activation of the muscle. So we can do a lot of rehabilitation and use electrotherapy, but I really believe that this electroacupuncture intervention was very important to get better that athlete. Then after the stimulation and the different interventions in different days, including my rehabilitation programs, then we saw a real difference. So that is one thing that is out of our scope of practice, but maybe it can be a great idea to have like uh, uh, be good in like training, have your preparation in the profession, but then including some oriental medicine things, more invasive. I think that's a good mix. That that program, that holistic view of how or to provide services or therapeutic interventions was really good, and I really believe that that model is pretty good to provide good services, to decrease pain and to have a better activation of the muscles, being more functional. The other thing, I have to get more deep in patient-rated outcomes. I know that I've been repeating this a lot, but that was one of the main ideas of my experience, to get more involved in PROs, because I really believe in that, but I had the opportunity to integrate it a lot in my services. But then I have found that you have to be prepared for that. You have to get deeper in that. You need to be an expert on that. Or, well, when I say expert, it's like knowing more than just having the idea of the existence of a PRO. Because I had the problem or the issue that I was just only 2 days on the week for 4 hours. So maybe I don't have the time to see the patient constantly. So doing that decision of what is the best PRO for the patient was a little bit difficult, And I believe in PROs. I really believe in these kind of instruments, but I think we have to be better, to get more educated on that and be an expert, to be confident and provide better services. The other thing is that we really know about the importance of documentation, but I don't know if all the professions do documentations as we believe, and it would be good for the profession, to increase our value or to demonstrate our value if we can integrate all those things that I'm talking about. PROs, clinical prediction rules, measuring results. We know that we are doing good because we have a lot of patients compared to the month that I started, and the earnings have been good. I'm gonna be talking about that in the final presentation. But then I'm not so happy on the thing that I believe that at the end of the experience of the class, of the course, I would have a lot of information, more than the PROs, to do a great analysis, to trying to do some changes, some policy changes. But for that, we have to get deeper in that. Not even me. I think that even the doctor, he do the documentations because it's really important, but it's not so deep as I believe. I'm trying to do analysis and integrate the quality improvement model, and I believe that the athletic trainers can do that in this kind of scenarios, providing the typical or traditional services that we provide. But then if we get experts on this O&A thing and getting better on using PROs and clinical prediction rules, then we can add that to the big picture of analysis and demonstrate our value. Is one thing is what you see, what you learn, what you read in the articles and seminars, and the other thing is really doing that. And I think time is one of the big factors on this. But then if we can change that approach, if we can be more active on that, I believe that the profession would increase value. And finally, the holistic approach. We are valuable for them, and they are valuable for us. And I know that this is not something new, but once you are there, you'll see how effective it is when you integrate different ways of thinking, different therapeutic approaches. So, and for the patients, we got a good results, but we know that if the patient were more active and trying to have better results, but including exercises to increase physical performance and to be more flexible, we know that is going to be a huge impact. So, yeah, that holistic approach was really helpful, and maybe we as athletic trainers, or we should as athletic trainers, get more integrating on that service. So it was a long video, I'm sorry, but yeah, that was my experience. Happy to see your comments. Thanks.